This video is specific to a distal bicep tendon tear and repair for the early stages when you're allowed to move your arm again out of the sling, so the early stages of rehab. Now, our main goal here is to protect any healing, not pull on any sutures that are trying to stabilize, and to normalize some range of motion, and more than anything, to get some swelling out of the limb. All right, so the swelling is handled by the lymphatic system, and the lymphatic system needs muscle action or muscle pump to get fluids up to the chest where it drains. So the first thing you want to do is you want to start distal, work proximal. So you're going to do any kind of squeezing or pumping of the hand. So any kind of ball would do, a tennis ball, a towel, or even just your hand. High repetition, 30 or 40 reps like that. Then you would do some pain-free supination and pronation. Starting off with maybe sets of 10, nice and controlled, no pain. Right after that, you're gonna go into some elbow flexion, and if you have to go partial range to start, that's totally fine. Right after maybe 15 reps like that, partial range of shoulder flexion, like that. Okay. Then we want to work it to the chest where it drains. So then you do scapular squeezes. That you can do plenty of those, 30, 40 reps.